A hearty welcome to GarbhaSandesha viewers and welcome to our 56th episode. And today's topic will be infertility treatments, its cost, success rates, and its benefits. And to talk on this subject, before I go to the doctors, I would like to inform our viewers that this topic was a choice of many viewers, which we are speaking about today. So likewise, if you have any other topic after today's, please let us know in the comment box. We will utilize that. We will talk on that particular topic from next week. Thank you. Initially, we'll be having Dr. Deepthi Venkatesh, who is MS OBG with fellowship in reproductive medicine. And with 7 years experience, who is our fertility specialist practicing at Jayanagar branch. Next, we have Dr. Shubha, who is MS OBG, DNB, fellowship in reproductive medicine, fertility specialist with 5 years of experience practicing at our Electronic City branch. Welcome to you, doctors.
Thank you, sir.
As you both know that today's topic is infertility treatments, cost, success rate, and benefits. I would like to have a quick take from you both. One, before I go to the main questions, Dr. Deepthi, your take on this subject, madam.
So it is very much the need of the hour because infertility is on the rise. As you can, earlier it used to be 1 in 10 couples. Now it is almost 3 to 4 in 10 couples who are facing some fertility issue. Not necessarily that they're infertile, but they're facing some issue with conception, subfertility maybe. And most of them are hesitant to come to us at the right time because the moment they think it's an IVF center or the moment they think of fertility treatment, they think what will be the cost associated with it? What if it doesn't succeed? It will all go down as a waste. So they delay their first consultation with us. Thereby, they're losing their golden period where they can come to us and conceive with simple treatments. So this session will help dispel all those misconceptions and in fact, let them know that we're here to help them with the best method possible, the simplest method possible for them with the highest success rate and clear all the misconceptions regarding the cost and other factors, the discomfort associated with the fertility treatments as well.
Thank you so much, madam. Shubha, madam, would you like to add anything?
As Dr. Deepthi mentioned, infertility is one of the most important and global cause right now for having pregnancies. One thing is infertility itself is not a disease. Anytime infertility will have a cause, either it could be male factor, female factor, or a combined factor. Most important at this moment is to know the cause so that the treatment plan can be done in a better way, simpler way, easier way, on financial grounds, on an emotional way, so that we can support the pregnancy, support the couple in the best way possible at our GarbhaGudi.
Thank you, madam. I would like to inform our viewers, like as the program goes by, as and when you have any doubts, you have a question, please post it. Our doctors would like to answer all those queries. Now, my first question would be to Dr. Shubha. Madam, what are the potential causes of infertility? How can they be addressed through treatment?
Before going to what is infertility, let us know what are the actual practical points in the female reproductive system. Hope you can see the uterus here. This is the uterus. These
Please
are
hold
the
it
tubes.
a bit above, madam.
You can, okay, now you can see this.
Yes.
Okay, now this is the whole uterus, single uterus. These are the tubes, the fallopian tubes, and we have 2 ovaries. So what does exactly infertility mean in case if the couple doesn't conceive or they doesn't become pregnancy in whole 1 year without using protection? Then it is infertility. So infertility is a myth. And also what should they know is immediately after they become married, they try pregnancy, they become frustrated within no time, within 3 months, 6 months, family pressures will be so high that they're not being conceived. So make it a point that stress-free coitus intercourse is more important. For first thing is to conceive. Second, it's 1 year completely without protection is what is related to infertility. So let us know what are the actual causes. In females and males, both are equally important causes, wherein which if we come into the female factor, we can have any issue in the uterus. It could be fibroid or it could be adenomyosis, or if the layer of the endometrium, if it is thin or it is thick or there is any polyp here, that could be one of the reasons. Second, if there is any block in the tube, either at the proximal point or at the distal point, or if there is any infection, which you can see here is the hydrosalpinx, or if there is any issue in the ovaries, meaning if the egg count is very less, or if egg count is very high, meaning PCOS, or if the quality of the eggs are compromised in the ovary, or if there is any cyst or hemorrhagic endometriosis, any type of the cyst which is affecting the quality of the ovary, that is what it matters for the female. And most important for females is stress. So when lifestyle management and the stress is reduced, that is when the cycles will become regular. And also at the same moment, you can have a pregnancy as fast and easily possible. But when it comes to males, it is most common cause is occupational hazard. It could be accidental trauma, or when they have any infection in the childhood, like it could be mumps, viral infection, or COVID infection recently, which has been come across. Or there could be severe oligoasthenoteratospermia, meaning the count, the motility, and also the forms which can be reduced. Or there could be no sperms at all when the process sample it has been taken, when it is called azoospermia. Or if there is any infection, any chronic infection, which is not treated or which is known but not treated, or it could be diabetic, hypertensive, any of the various causes, it could matter. Most important and the commonest cause for both of the male and female is occupational stress and sleep disorders. So when these three things can be cut down, or it could be managed in a better way, infertility issues can be treated in a very best way possible with any of the infertility specialists. And now coming up, what could be the options that we will speak in this session?
Thank you, madam. We got a comprehensive answer from you. Dr. Deepthi, what are the various treatment options available for infertility?
Okay, so now just like Dr. Shubha said, what are the causes for infertility? So what, depending on the evaluation, when we get to know what is the cause, we can direct our treatment towards it. Coming to the range of infertility treatments available, there are about 3 steps. Okay, so the simplest is when the woman is young, the married life is less than 3 years. The semen analysis, like Dr. Shubha said, we evaluate the count, we evaluate the motility, we evaluate the normal forms. Normal forms meaning if the head, neck, and the tail of the sperm are normal, how many percentage of these sperms are normal, we evaluate it. And if everything is found to be favorable, both the partners are less than 30 years of age, we then suggest simple measures like ovulation induction and timed intercourse, or natural cycle monitoring and timed intercourse. So here what we do, if you're inducing them on 2nd or 3rd day of the cycle, we see the woman, we see their ovaries, how many follicles are there, and we give them oral ovulogens usually, meaning letrose or clomiphene citrate, which are ovulation inducing drugs. Then at regular intervals, we see them to see if a follicle is developing, if we need to add injectables. Once the follicle is ready, what do I mean by ready? If it is more than 18 to 20 millimeter, we give the final trigger for maturation. It is a HCG trigger, which will cause maturation and rupture of that follicle. Finally, when we see the rupture, then we tell them, once we give the trigger, to have intercourse for 3 days, and then we confirm that that follicle has ruptured. This is timed intercourse. This is the simplest treatment available. The success rates is almost comparable to a natural pregnancy, how they try naturally. It is around 4 to 6%. So the next step is IUI, where the procedure will be similar like what I just told, but additionally, after we give the trigger, we see them 34 to 36 hours later, confirm that the follicle has ruptured, and instead of telling them to have intercourse, we tell the partner to give the semen sample, we process it or filter it, so that all the dead sperms and the bad quality sperms get washed away, and the fast moving motile sperms in a quantity of around 0.3 to 0.5 ml under scan guidance, we place it in the uterine cavity, so that then they have to go and meet this egg in the tubes. This is called IUI, and the success rate is around 15 to 20%. Okay, so why this increased success rate? Because first, we are filtering out the dead sperms, increasing the motility of the sperms. Second, we're confirming rupture, and we're decreasing the distance that the sperm has to travel. If this also fails, or in some cases, the woman is more than 35 years age, she has low ovarian reserve, or like Dr. Shubha said, there is decreased count, there's decreased motility, or there is very abnormal forms or less than 1% normal forms, then we suggest something called IVF or ICSI. Or even for patients who have tried this timed intercourse and IUI a couple of times, not found success, or something called unexplained infertility. They've been trying everything is happening properly, but they're not conceiving. Then we go ahead with something. See the woman on day 2 or day 3, see the number of follicles, rule out if there is any cyst or anything, then do the hormonal evaluation. And if everything comes out to be normal, we start them on gonadotropin injections. What are these gonadotropin injections? They're hormones which are produced in our body, but we give them as external injections in a much higher dosage. Because in IUI or timed intercourse, we want just 1 or 2 follicles to grow. But in an IVF, if we're seeing around 6 on each side or 8 on each side, we want most of them or all of them to grow. So these injections will last for about 10 to 12 days. And in regular monitors of 2 to 3 days, we'll be monitoring the scans, seeing how the follicles are growing, adjusting the dose of gonadotrophins accordingly. And once most of the follicles are ready, that is, most of them cross 18 millimeter, we give the final trigger injection, post which this trigger injection is the most important point in an IVF program, post which 35 hours later, we do the egg retrieval or the egg pickup. This is done in an OT under anesthesia, where under scan guidance, we go and prick each follicle and aspirate the follicular fluid, which is then given to the lab. They tell us the number of eggs found immediately, and then the quality of the eggs also within 3 to 4 hours. Then we go ahead and inject the mature follicles or the mature oocytes with each sperm. This is called ICSI. Then we grow these embryos in the lab for 3 to 5 days, post which it is put back into the uterus of the woman, either in the same cycle or after a gap in a frozen embryo transfer. And this is the whole process of IVF. So the success rates of this procedure is around 55 to 60%, which is the average success rate. Depending on the individual embryo quality, this can be much higher as well.
Thank you, Dr. Deepthi. That was very informative. Dr. Shubha, next question will be, which has been partly answered by Dr. Deepthi already. Please explain success rates associated with different infertility treatments, such as in vitro fertilization, IVF, and intrauterine insemination, that is IUI.
Most of the couples come to our center and then they ask for IVF, but they wouldn't know that it is IUI. And most of them have confused what is IUI versus IVF. And also one more thing is they wouldn't think what is important or what is not important until unless an infertility specialist explains what exactly is the treatment procedure, how it is to be going to be done, what all exactly is required, what is the chances of pregnancy. When it is explained to them, the patient would be better to understand on their financial grounds and how emergency that the pregnancy has to be required for their family. So when it comes to an IUI success chances matters on different criteria. First, on age of the patient of both, that is on age of the couple. If it is less than 35, it is far better. Then the egg quality, egg number, how do they grow from day 2 to day 12 or day 14? And how is the scan findings when the follicle is being growing? Is it the blood flow is in a good way? Is the endometrium in a good way? So it has to be done by a specialized person. If it is an infertility specialist, it is far better, so that they will do the scan in a better way. And also when it comes to all the other conditions which has to be ruled out, is it being polyp or there is any cyst or any endometriosis, all if it is can be ruled out and then started with a good process, with a good tablets and injections. that is when the chances of pregnancy could be better in an IUI cycle. When it comes to male factor, definitely the count has to be better. If it is more than 15 million and the motility of 30%, far better the chances. And all the lifestyle changes which can be modified will have better chances. So when it comes to less than 35 years of both the couple, especially female age, it will be 15 to 20% IUI success chances. If it is more than 35 years or 40 years, chances gradually reduces. It could be 5 to 10%, or maximum it can go to 10% or 12%. So the chances of IUI is far better than the natural cycle or timed intercourse. That is definitely yes, because Dr. Deepthi has explained the timely intercourse and IUI is completely different. We process it, we select the whole thing. So, but the chances still is not better than an IVF. So when it comes to an IVF, the success chances depends on various factors which has been already mentioned, all both as female and male, including these criteria which is mentioned along through the IUI. The other factors is especially the hormonal injections, selectively customized to the patient, and also it has to be given by person who is trained for IVF injections. It has to be given in a place which is being trained by a person in a center wherein which they can handle the complications plus or minus. It has to be taken in a proper timing. Scan has to be done by the same person. Injections in the same center. Procedure has to be done in the same center. And ICSI, whatever is the embryo formation, everything, if it is done in the same center, like what we do at GarbhaGudi. So if it is done everything at the same place, chances is far better, and we will know what is the quality of embryos. So the chances of success of pregnancy in an IVF when it is less than 35 years, especially for the female age, it would be 55 to 60%. If it is more than 35, it will gradually reduce. It could be 30 to 40% or lesser than that. And if it is less than 25 or 30 years, chances can go up to 72% also. At our centers, we have gained our pregnancies till 84 to 85% also. So it depends on the criteria of both female and male. How do we select? How do we process? And also how do we proceed, counsel, everything. You need to be honest enough, explain the whole process. What is IVF from the start of the scan of day 2 till the transfer and post-transfer. That is when you will win the confidence with the patient, and also at the same time you have been transparent enough on all the lines so that they can have a better consultation, better chances with the positive thoughts. And IUI also should be done in the same center. It is done when in the scan, the procedure, sample processing, if it is done in the same center, chances of pregnancy or chances of having a better success chance is easy. So IUI and IVF is definitely done at our GarbhaGudi. Please do visit if in case there is any issue at Infertility Point.
Thank you, madam. I would like to inform our viewers that currently we are having free IUI offers running at all our 7 centers in Bangalore. Along with free IUI, you can avail free consultation services also. And this offer is valid only up till March 31st. So please rush to your nearest centers in Bangalore. We are at 7 different locations in Bangalore to avail these offers. Next question is coming to Dr. Deepthi. Madam, how many treatment cycles might be necessary before achieving a successful pregnancy?
Thank you, sir. So depending on the criteria, patient selection, the success will vary. Suppose it is a young couple who've been married for hardly, say, 3 years, but they've been having irregular cycles. The issue is irregular cycles where the female was not ovulating at all and everything else is normal. Then simpler treatments like timed intercourse might give success in the first 3 cycles itself. Suppose the issue is something more profound, like the woman is ovulating, the tubes are open, but the husband's count is less than 15 million or slightly lesser, or the motility issue is there. Then we tell them straight away, if the count is less than 15 million but more than 10 million, to go ahead with an IUI. In such cases, we look at the post-wash sample. Suppose the post-wash sample is very good, the IUI has happened at the right time, we've confirmed the rupture, and it has been an easy procedure, then the success rate can be there in the first cycle itself. We have many couples who come to us, done just irregular cycles, they've undergone a diagnostic hysterolaparoscopy. Next cycle, they've conceived naturally itself. So the thing is to go meet the right doctor who can get to the root cause, along with just looking at the uterus or semen, who also evaluates your thyroid and sugars. Get to the root cause, gives you holistic treatment and a well-centered approach, then your success chances increases. But more important than how many treatment cycles does it take to achieve success, we should know when to stop. Like, you cannot go on doing 12 cycles of timed intercourse and push it on for 2 years, beyond which there is no reserve left. So we get patients like this also who are not referred at the right time, or they don't know that they have to go to the next step at the right time. So they exhaust their reserve and come to us. And at that point, even an IVF giving success would become difficult. Like Dr. Shubha said, if they come to us beyond 38, beyond 40, it becomes difficult. So what I would like to say is, do 3 to 4 cycles of well-timed intercourse. If you're less than 30 years of age, you've got a fairly normal semen analysis, your tubes have been evaluated, you're not obtaining success with this, go to the next level of treatment. Or for some factor, if the fertility expert tells you that you need to go to an IUI only first because of your borderline reserve or because of the decreased counts, then even with an IUI, if you're going to obtain success of this 15 to 20%, maximum is in the first 3 cycles or 4th cycle. Beyond that, studies have shown that, in fact, if we go on doing a 4th IUI cycle, a 5th IUI cycle, the success rate comes down. Okay, so in IVF, the success rate is obviously, like Dr. Shubha said, around 60%. So with one IVF, almost if 100 people go through IVF, 60 to 65% of them conceive with the first transfer. So this is the success rate. So to tell how many treatment cycles are necessary for each, with an IVF, it might be just one that is necessary. With an IUI, most of them conceive within the first 3 cycles. And with a timed intercourse, we tend not to do more than 4 to 5 cycles if they're well timed and well done, and the couple's age is favorable for us.
Thank you, madam. Dr. Shubha, next question is to you. And I would like to inform our viewers that you can ask questions both in English, Kannada, and Telugu, because these 3 languages our doctors who are speaking today are well versed in. Next question is to Dr. Shubha. Are there any lifestyle changes or additional measures to enhance the effectiveness of the infertility treatments?
We have various examples to quote for this lifestyle management. We had got a couple who is 24 years and 27 years, an IT couple basically. Her weight was 85 and he was around 95 kgs. Trying since almost 3 years. Married life almost like 7 years, but trying since 3 years, they were frustrated because they had multiple visits for multiple hospitals had been gone. They had mentioned that these treatments are better and doesn't look anything abnormal, so try naturally. So they had tried with ovulation induction, as Dr. Deepthi had told, which is success chances is hardly 5 to 10%. Then after that, one IUI was done, wherein which they had failed to conceive. So what was the root cause when we had done a scan on day 2? So I noticed that it was PCOS, meaning she had many eggs in the ovaries. And also they had not evaluated the tube, meaning tube was blocked or open, we have no clue. So third thing, the uterus lining was not that great to implant the embryo. So there are 3 factors along with weight, that is obesity. So obesity plays a very, very important role for the infertility issue. Of all this, stress. Because she was working in the night calls from around 10 o'clock to 2 o'clock, and then her night sleep is most important, which is disturbed. Hormonal levels, wherein which the most important LH has been crossed the levels at PCOS, and therein which ovulation is not happening. So all these factors was not clearly explained to her in a serious way from any of the doctors. When it comes to him, he was already 95 plus. He was also doing shifts almost from past 3 to 4 years. The lifestyle was completely haphazard, diet was crashed, everything was not a routine. The exercise or the physical activity was not at all being followed, not maintained in a proper way. And he had oligoastheno, the count was less than 15 million. The motility was not that great, which was not explained what has to be done. So all these factors, again, we took it in a very serious way, explained them what should be done, what has to be done. The next 3 cycles, we tried telling them, do serious to change all the lifestyle changes. And then obviously they reduced the weight. They came up to almost 85 to 82 and then came up to 75. Both of them strictly followed. And they, by the time I could plan for an IUI, they have naturally conceived. So that is one of the chances that we have to be very serious on what note, what are we trying to convince them. Communicate and counseling is the most important thing for any of the patient when it comes to lifestyle. What exactly is lifestyle? Lifestyle meaning what are the changes which can be done for your life and can be maintained in a better way for your health is all what it matters is lifestyle changes. So in lifestyle, first important is diet, second is physical activity, third is sleep, fourth is the habits, and lastly is the stress levels. When it comes to diet, especially diet meaning follow some particular diet and then stop it and then you can't maintain it as not diet. Diet is something which has to be done on routine daily basis. Why will elders do that? Seasonal fruits has to be eaten? Why should we eat this for your pregnancy? Why? Because that is what is nutritious, that is proteinaceous. So what is more important is which has to be followed for the lifetime, has to be continued as a diet. Not because you have to lose weight, not because you have to do something, but just maintenance is what very, very important role plays in any of the treatments and also to the health. And first important when it comes to diet, have proper meal at proper time in a sufficient way. Not heavy, not less. When it is eaten in a proper way, taken in a proper timing is what it matters. Skipping any breakfast, skipping any dinner is really not correct. When it comes to fruits, try all the seasonal fruits, whichever is available and in your places. Not something exotic because it is giving some nutritious like kiwi fruit, dragon fruit, whatever is available in the market because it is looking very fantastic, fancy. That doesn't matter, but whatever is available at your cost, at your finances, at your places, especially at villages, our dragon fruit is not available. Our avocado is not available, but that doesn't mean that there is no other fruit which can replace these things. So you can eat apple, pomegranate, oranges, amla, and butterfruit, whatever is possible, whichever is being given to you, please have it. When it comes to vegetables, all type of vegetables include carrot, tomatoes, spinach, green leafy vegetables, whichever option available in a daily basis. And it doesn't mean that carrot every day to be eaten so that your egg quality will improve. So try to combine everything so that you will have a better meal every day. Along with it, dry fruits, if it is the soaked badam, avocado, or anything soaked almonds, which will be better, cost effective, will be taken, will be better. So along with all this, water content or water sufficiency or 3 to 4 liters of water is what is very, very important for our body. When it comes to summer, especially at this moment, have more and be hydrated. When it comes to second, physical activity, we know physical activity has become a trend on all the social media, but we don't follow anything, but we just view up and down. So what is important is have your personal attention, at least give 1 hour to yourself, mentally, that is mindful, and also physically on bodyful. Basically 40 to 45 minutes of exercise of whatever pattern. It could be walking, jogging, swimming, aerobics, yoga, meditation, or whatever of the combination, whichever you like it or not like it, please include in your lifestyle changes. It is not that compulsory that you have to follow it 7 days a week. It is impossible to any working couple. So please at least try to do 4 to 5 days in a week. If you can do it individually, well and good, or if it is in a couple or in a family, you can include so that the positive energy will vibrate in everyone. Third is sleep. Sleep is the most important and the vital role in any of the health issues. If 6 to 8 hours of sleep and a peaceful sleep without using any of the mobile gadgets, electric gadgets, if you can have a sleep, that is the best treatment whichever is possible rather than thinking about anything. And for our infertility patients, this is the most stressful factor that we don't get sleep. Why? Because they have all the thoughts possible. They don't trust anything. They don't trust either the treatment. They don't trust either the doctor or any of the things. And the last part is they don't have the positive thoughts at all. When they don't have the positive thoughts, there's no point that sleep will be peaceful. So when you have a trust on everyone and have faith on God, then definitely sleep will be peaceful. Coming up to the fourth, stress. I know every couple is a working couple, either male or female, but at the end of the day, when you're sleeping, leave all the stress out and then sleep peacefully. Every person has a stress in all the other ways possible, but whether the stress will affect us or we are getting affected with the stress. So stress can have a cause. So you need to sort out what is the cause. Speak up in whatever way possible. Think about it. Finish it. Don't drag it and clear the things. Stress should not make us more stressful. And lastly, the habits. When it comes to habit, coffee intake in our India, especially when it comes to Bangalore, is highest.
Sorry to interrupt you, madam. I feel we are running out of time. So I would like you to, cap it initially right now.
Infertility is not a disease as I have mentioned, and also it's not a myth. Everyone will have a cause, and the cause has to be seen in a very clear manner so that the treatment point will be simpler, easier, and best way possible to achieve them as a pregnancy.
Thank you, madam. And that's all we have time for today. Viewers, if you have any particular topic as informed earlier, please mention in the comment box. We'll take that topic up for our next episode. And I would like to inform our viewers that we are running paid OPDs at Tiptur in Janashri Diagnostics and Zion Hospital, Kalyan Nagar. These are two paid OPDs. That's all we have time for now. Thank you for joining us.
Thank you.
Thank you. Thank you, doctors.
Thank you.